infectious diseases. I don't have an intro slide, sorry guys. Okay, pertussis. Pertussis or whooping cough. The symptoms of pertussis include chronic or severe coughing, runny nose, sneezing, fatigue, fever, vomiting, watery eyes, and periods of no breathing. Nothing really gross on this slide, so sorry. The pertussis pathogen. Whooping cough is a disease caused by a pathogen that invades the respiratory system. This pathogen secretes a toxin that disrupts the normal function of cilia in the lungs, resulting in a severe cough. Pathogen, which is called Borrelia pertussis, and these are pictures of the history. The bacteria itself was found in 1902 by Bordet and Ganharu. I don't know which one they are. The whooping cough had killed hundreds of people in the 1800s, but the bacteria was not discovered until the early 20th century. The pathogen is named after the two scientists who discovered it. How it enters the body. The bacteria can enter the body one of two very contagious ways. One is it can be transferred through the air by breathing it in. If people cough, the bacteria can be inhaled by a sterile person. And another is when a sterile person touches the surface with the bacteria on it. Prevention. Receive your vaccine at a medical facility before you get it. This is the most effective way to make sure that you don't receive the disease. Also, good hygiene. Wash your hands and surfaces to prevent germs from spreading, and cover your cough with your arms. Who gets whooping cough? Whooping cough is most common between kids of less than 1 and around 4. And it's very serious if younger kids get it. I can't remember the percentage, but there's been many deaths from whooping cough, so pertussis for kids, and however, it can be received at any age. Treatment is it can be treated with antibiotics. It's most important to start taking the medicine as soon as possible to slow the spread of the disease. Early treatment may also make the symptoms less severe, so the sooner the better if you start seeing symptoms. All right, syphilis. Syphilis symptoms: difficulty feeding, poor weight loss, fever, severe rash around the mouth, anus, genitals, and deformities of the nose, upper arms, and shins. This is pictures of the rashes. All of them are, and that guy. That's so. Pathogen. Syphilis is usually always transmitted sexually. It's caused by the pathogen called Pneumococcal pallidum. This bacteria has a wormish shape and is very hard to detect, for it exists in many possible forms. The history, it's also known in history as the great pots or the great crippler. Pneumococcal, the bacteria, was first identified by Fritz Schotteden, and Eric Hoffman, in 1905. The first effective treatment for syphilis was salvarsan, developed in 1910 by Paul Ehrlich. In 1943, trials of penicillin confirmed of its effectiveness to treat syphilis. How syphilis enters the body. Syphilis starts when the bacteria enters the body through mucosal membranes, usually during sexual contact. The bacteria commonly enters the genitals, rectum, or mouth, and then enters the bloodstream and spreads throughout the body. Celebrities who have had syphilis. Al Capone, the gangster from the 1900s, has found that he had syphilis when he went to prison. He found out that he had it for multiple years before that. Adolf Hitler, he experienced manic attacks, itching, and stomach pains, and of course he blamed a Jewish prostitute. Abraham Lincoln got the disease around the early 1930s and gave it to his wife, which is a possible reason for her death. Prevention of syphilis: don't have sex. Syphilis is mainly transferred through sexual contact, so just don't have sex. Or if you're just too aroused, I guess.
Oh my god.
Just use safe sex. Use a condom. It's an easy and safe way to prevent syphilis. You can avoid drugs and alcohol as well, and this won't directly prevent syphilis, but may prevent sexual behavior. Treatment of syphilis. Syphilis cannot be fully cured in the late stages, but in the early stages it can. Penicillin has been very successful at stopping and spreading the disease of bacteria. Other antibiotics like doxycycline and amoxicillin can also stop the disease. However, penicillin is the most effective. Warts. Warts, symptoms, fleshy, painless growth on the skin of our hands, feet, and genitals. May also experience itching and lesions in the mouth and genital region. That guy's got a lot of warts. The virus that causes warts, Prenolium imitatum is the name of the virus. This is the virus of genital warts and skin warts as well. Verculo vulgaris, which is that one, is common warts. The virus is small in size and are a dot in oval shape, and they move in groups. History of warts. The wart was not found to be caused by a virus until the late 1950s, although during the time approximately through 14 through 34 AD, Alyssus Cornelicellus, that guy, described potential treatments for warts in his text De Medicina, on medicine is what it's called. The knowledge of warts as sexually transmitted disease goes as far back as Greek and Roman physicians. How warts enter the body? The common skin wart can be contained by skin-to-skin contact. However, not all wart viruses are contagious. However, surface warts cannot be spread to other parts of the body by skin-to-skin contact. So if you have like warts on the skin, you're not going to get it. You're not going to get genital warts from touching somebody, shaking their hand. You're not going to get genital warts from that. Wart prevention. Avoid touching warts on yourself or others. Do not share razors, towels, socks, or shoes with anyone. Avoid walking barefoot on warm, moist surfaces where the wart virus may be alive. Keep your feet dry. Avoid irritating the soles of your feet.
And don't kiss frogs.
Wart treatment. You can just let it heal, which is the easiest. They usually don't last. They only last for a few months. Freezing does work to minimize the size of warts. And cauterization and laser surgery are also options to remove warts. That's laser. That's a guy just cutting it off with a
That's disgusting.
Don't do that. He's gonna get tetanus. Which is the last one.
Good job.
Myths about warts. Warts are not obtained by touching frogs or toads. Warts can actually grow back just because that they're gone. They could come back within a couple of months. And warts do not have roots and only grow on the very top layer of your skin.